Hi, my name is Greta McCoy, and I'm a registered dietitian and certified diabetes care and education specialist at Texas A&M Coastal Bend Health Education Center's Diabetes Education Program. Today we're going to be talking about gestational diabetes. We're going to go over what gestational diabetes is, some of the signs, symptoms, and potential complications, our tests and treatments, and how to manage gestational diabetes with exercise, food, and stress management. We'll also talk a little bit about how to prevent type 2 diabetes in the future. Let's start with our overview. There are two tests for diagnosing gestational diabetes. They are done during the last trimester of your pregnancy. One is the glucose challenge test, and the other is the oral glucose tolerance test. Both involve drinking a sugary beverage and having your blood sugar checked at timed intervals after. The reason that you're here is because your values were above normal. Gestational diabetes is when the mother's blood sugar goes above normal values due to the hormones produced by the pregnancy. This usually happens late in the pregnancy during the third trimester. Sugar in the diet does not cause gestational diabetes. However, changing your diet is going to be part of the treatment. When your blood sugar goes above normal, your baby's insulin levels increase in response to the abnormal blood sugar. This causes the baby to gain a lot of weight and become somewhat fluffy. When the baby gets larger than 9 pounds, it can result in a difficult delivery and some complications after delivery. Signs and symptoms. Often you will have no signs or symptoms that you have gestational diabetes or that your sugar is above normal. However, some women feel more tired. You can also have increased thirst or have to go to the bathroom more, especially after a large meal. You might also feel more hungry than normal. There are several risk factors for developing gestational diabetes. You may have an increased risk if you've had a prior pregnancy with gestational diabetes. Also, if you have a family history of type 2 diabetes. They are of African American, Hispanic, American Indian, Alaska Native, Native Hawaiian, or Pacific Islander descent. Your age may also play a factor in developing gestational diabetes. Having gestational diabetes also puts you at risk for having gestational diabetes at your next pregnancy, developing type 2 diabetes later in life, and again, delivering a baby that is larger than average size. There are complications associated with untreated gestational diabetes. Potential complications include high blood pressure, which is also known as preeclampsia and eclampsia. There can be too much fluid around the baby. You are at risk for going into preterm labor or having an early delivery. You can also have a delivery that is cesarean, and you are more prone to some infections. The goal is to keep your blood sugar as normal as possible for the duration of the pregnancy. There's also problems with untreated gestational diabetes for the baby. Potential problems for your baby can include macrosomia, or a larger than average size baby, hypoglycemia after delivery, hypocalcemia, or low calcium after delivery, jaundice, which is a yellowing of the skin, and respiratory complications. Again, keeping your blood sugars as normal as possible through the duration of your pregnancy can prevent most of these complications. Let's talk a little bit about high blood pressure. High blood pressure during pregnancy is called preeclampsia. Gestational diabetes does put you at risk for having preeclampsia. This often happens in first-time pregnancies or for women who are over 40 years of age. It may appear at any time during the pregnancy and is often the first time that a patient experiences high blood pressure. Preeclampsia is diagnosed when blood pressures average over 140/90. Again, there are often no signs or symptoms of preeclampsia, so it's very important that you see your doctor regularly. However, you can have some sudden swelling. Usually during pregnancy, you can have some swelling in the feet and ankles, but this swelling is around the face and eyes. You can have a sudden weight gain over a few days, and you can have some headaches with dizziness and stomach upset. Treatment for preeclampsia can involve many things. Sometimes your doctor may ask you to limit your activity and stay in bed. Sometimes you need to decrease the sodium in your diet. May need to test your blood sugar and blood pressure more often during the pregnancy. And in severe cases, you may need to be hospitalized for treatment. Women with preeclampsia may not have any symptoms, so it's important to go to all your doctor's appointments. Preeclampsia that is untreated can change into eclampsia, which is more severe. Eclampsia has some major complications and includes seizures, liver disease, and kidney disease, and can result in some fetal distress. It's very important that you go to all your appointments and have your blood pressure checked regularly. The following symptoms suggest the beginning of eclampsia. And they can include upper right quadrant pain, severe headache, and vision problems. If you experience any of these, it's important to call your doctor right away or go to the emergency room. Preterm labor. Gestational diabetes can increase your risk for preterm labor and delivery. Some of the signs and symptoms of preterm labor are more than 4 contractions in an hour. You can also have some vaginal spotting or bleeding, or gushing or leaking of fluid. Persistent low back pain can also be a symptom. If you experience this, call your doctor. It may have you do some kick counts to see how the baby is doing. Gestational diabetes can be treated and controlled. With proper monitoring, diet, and education, you can have a healthy pregnancy and delivery. We're here to help you do just that. For our next session, we're going to be talking about how to take care of yourself with gestational diabetes. As you recall, we talked about some of the complications that could happen. With proper treatment, again, none of those complications need to be a concern. Let's start off with monitoring. Your doctor is going to ask you to check your blood sugars regularly and will provide a meter and all the supplies for you. You should be checking your blood sugar at a minimum of 4 times daily. First thing when you wake up before you have anything to eat or drink, and then 1 hour after each of your 3 meals. And yes, we're going to ask you to eat 3 meals. It's important that you record these results and bring the results to your doctor at every visit. Here are the recommended targets for you. First thing in the morning, you want your blood sugar to be between 65 and 90 milligrams per deciliter. 1 hour after your meal, blood sugars can range from 70 to 120 milligrams per deciliter. The foods that you eat are going to affect these tests, and we'll discuss that in just a little bit. The meter you get will come with all the equipment that you need. It's very important that you wash your hands or clean your finger with alcohol. Inside the box will be a lancing device used to poke your finger. If you poke on the side of your finger instead of the center, it is usually less painful. It's also important to remember you don't need much blood for these tests. Very small poke will be just fine. Once you poke your finger, hold the test strip into the drop of blood and the result will appear on the meter screen. Again, it's important to record these results and bring them with you to the doctor's office. Make sure the time and the date are correct in your meter. What is a low blood sugar? Hypoglycemia or low blood sugar can be caused when you miss a meal or a snack, by taking too much medication, not eating enough carbohydrate, or being more physically active than normal. Signs and symptoms of low blood sugars. Again, you may not experience any symptoms, so it's important to always check your blood sugar. However, some of the signs of a low blood sugar can be feeling dizzy or weak, feel a little shaky, can feel very hungry, and you sometimes can get the cold sweats. If this happens, it's important to check your blood sugar first and then follow what we call the rule of 15. Once you check your blood sugar, if it is lower than 65 milligrams per deciliter, you want to eat a quick sugar snack. That can be something like 4 ounces of juice or soda, some hard candies, or glucose tablets that you can find at your local pharmacy. Once you eat these, it's important again to wait for 15 minutes, which can be difficult. Wait for 15 minutes and then retest the blood sugar. If it is not above 70 milligrams per deciliter, repeat the treatment and wait again for 15 minutes and recheck. Once the blood sugar is above 70 milligrams per deciliter, it is important to have a meal or snack with some protein in it to maintain the blood sugar. Your doctor may give you different values for low blood sugar, so it's important to discuss that with them at your visit. What is a high blood sugar? Hyperglycemia or high blood sugar can be caused also by many different things. Most often it's caused by eating too many carbohydrates, missing medication, or being less physically active. Some signs of high blood sugar include increased thirst and urination, especially after a meal. You can also feel increased sleepiness or fatigue, and sometimes increased hunger. It's important, again, to check when you are having any symptoms. If your blood sugars are high, your doctor may ask you to check for urine ketones. This can also happen if you are ill or unable to keep food down. Ketones are found in your urine, and the test for them can be purchased at your local pharmacy. You'll hold this stick under your urine stream and then compare it to the bottle. It usually occurs when the mother is unable to eat enough and can signify that you and the baby are not getting proper nutrition. If you are positive for urine ketones, it's important to call your doctor immediately. Some other treatments for gestational diabetes. The main goal is to keep your blood sugars normal, and this can be achieved very easily with some physical activity, following a healthy diet, and watching your stress level. Let's talk a little bit about physical activity. Exercising regularly is a good way to maintain blood sugars, get your body in shape for labor and delivery, and help you keep a healthy weight. Visit with your doctor about what is reasonable, but we recommend somewhere around 30 minutes of exercise 2 to 7 days weekly. A walk after a meal or in the morning are great ways to add exercise. Physical activity is going to help control your blood sugar. It's going to relieve stress. Always check with your doctor before beginning any physical education program. Now let's talk about meal planning. Meal planning is an important part of controlling your diabetes. And one of the most important things you can do is establish regular eating schedules. It is important that you don't skip meals or have a large meal and then not eat the rest of the day. Eating small amounts at each meal and each snack will help maintain your blood sugar levels. Again, it's important that you don't skip meals, especially breakfast. There are 3 major nutrients we will be focusing on: carbohydrates, protein, and fat. Carbohydrates provide most of our energy. They do have the biggest impact on your blood sugars and will have to be closely monitored. You will have a set number of carbohydrates at each meal. Carbohydrates raise the blood sugar more than any of the other foods. They are found in starches like breads, grains, cereals, starchy vegetables, rice, pasta, all the good stuff. They are also found in fruits and milk, yogurt, and ice cream and pudding, and most of our snack foods like chips and cookies. Each serving of starch contains around 15 grams of carbohydrate. For example, 1 slice of bread, a half cup of cereal, a half to a third of a cup of rice or beans, and 4 to 6 crackers. Some vegetables also contain carbohydrate. Our starchy vegetables include corn, peas, potatoes, sweet potatoes. Fruit is also a carbohydrate and does contain sugar, but it is part of a healthy meal plan. It's important that you monitor your serving sizes of fruit. A serving size of fruit would be 1 piece of fresh fruit about the size of a tennis ball or a woman's fist, a half a cup of canned fruit that is rinsed off, a cup of fresh fruit, or 2 spoonfuls of dried fruit such as raisins or cranberries. It is very important that you avoid fruit juice unless your blood sugar is low. Liquid sugars raise the blood sugar faster than any other food and should be limited. Milk is also a carbohydrate. A serving of milk is 8 ounces of fluid milk, 4 to 6 ounces of yogurt, or frozen yogurt or low sugar pudding in the small 4-ounce containers. Carbohydrates that should be limited but not necessarily avoided are sweets and desserts, pastries, ice cream, and sauces and condiments. It's important to know the carbohydrate content of these foods so you can safely work them into your meal plan. There are carbohydrates that should be completely avoided. Those are regular sodas, juices, any sports drink, milkshakes, punch, fruit punch, and any energy drink. Non-starchy vegetables contain only 5 grams of carbohydrate per serving. Most often, non-starchy vegetables can be safely added into your meal plan at any time of the day and in any amount. However, a serving size of vegetables would be a half cup of cooked vegetables or a cup of raw vegetables. During the pregnancy, it's important that you keep proper nutrition and get all the nutrition that you need for you and the baby. Choose a variety of different seasonal, fresh vegetables and include them into your meal plan. Remember, if vegetables are battered and fried, they now contain carbohydrates and will affect your blood sugar at a greater amount. Protein. Protein gives us energy 2 to 3 hours after it's ingested. Proteins do not contain carbohydrates and usually do not affect blood glucose. They do provide repair and growth for cells, tissues, bones, and muscles for both you and baby. Try and include small amounts of protein at each meal and snack to help stabilize your blood sugar. Some examples of protein foods are beef, chicken, fish. Make sure fish is cooked through, no sushi. They can also include eggs, cheeses, pork, and even wild game if you have a hunter in the family. There are some proteins that are meat substitute. Include all of our cheeses, eggs, nuts, peanut butter, and tofu. These can be safely substituted for any protein serving in your meal plan. It's important to make sure you're using lean cooking techniques, especially when you're cooking meats. So it is preferred to bake, roast, broil, or grill as opposed to frying your meats. Again, avoid any raw or undercooked meat or protein. Fat. Fat provides lasting energy up to 3 to 5 hours after you ingest it. Again, fat does not contain carbohydrate and will not affect your blood glucose, but can affect your weight. Reducing fat in the diet is beneficial to both you and the baby. Make sure that you are also choosing what we call healthy fats. These are plant-based fats. It's better to choose these over things like butter and lard, and they include avocado and olive oil, and also nuts and plant-based oils when you're cooking. Learning how to read a food label is a very important part of treating your diabetes. All the foods in your pantry or the foods that you get at the grocery store should have a food label on them. There are 2 specific places you need to look first. At the top of the label, under the nutrition facts sign, you need to find the serving size. Remember, the serving size is not what you or I think of as a serving, it's what the company decides is a serving. Underneath the serving size is the servings per container. It's also very important to make sure, if you eat the entire package, to multiply everything on the nutrition label by the servings per container. Then you want to go down to where the total carbohydrates are and look at the grams, not the percent. Remember that each of your meals should contain somewhere between 30 and 45 grams of carbohydrate. The amount of total carbohydrate is the amount you get by eating 1 serving as listed as the serving size. You do not need to add in or even be concerned about the sugar grams on the label. Focus only on the total carbohydrate grams. Again, if you eat more than 1 serving, you need to add additional carbohydrate grams for each serving that you consume. There's some other things to think about besides carbohydrates during your pregnancy. As we've said earlier, it's important to eat 3 meals a day. Many of us are accustomed to skipping meals, and it's very important that you get in the habit of having 3 small meals with 3 small snacks. It's recommended that you have between 35 and 40 grams of carbohydrate at each of your meal, and somewhere between 15 to 20 grams of carbohydrate at each of your snacks. How you choose to get to those carbohydrate amounts is up to you. Don't skip meals or start any fad diets during this pregnancy. It's also advisable to limit your caffeine. Generally, it's recommended to not have more than 200 milligrams of caffeine during a pregnancy. However, your doctor may give you a specific amount. Remember to wash all fresh produce before you eat it and make sure things are cooked properly. Here is a sample meal plan that we've put together. As you might recall from our first session, we talked about preeclampsia and eclampsia, which are high blood pressure during pregnancy. Part of the treatment and prevention of preeclampsia is reducing your sodium intake. Please keep in mind that all salt has sodium, whether it's sea salt, pink Himalayan, or kosher. It is recommended that you get no more than 2,300 milligrams per day of sodium. You can use the food label to double check how much sodium is in each of the foods you consume. Remember, the sodium grams are also listed per serving. One of the best ways to reduce sodium in the diet is to limit your consumption of prepared foods like canned foods, frozen dinners, food from convenience stores, and snacks like chips and crackers. If you would like to include some of these in your meal plan, make sure you look for ones with a green ribbon marked as lower sodium. We know that during your pregnancy, you'll probably want to go out to dinner a few times. Here's a simple acronym to help you remember to make good choices when you are out to dinner. We call it the power of choice. Remember to control the portion size. Sometimes you can order a lunch portion or senior portion, which is smaller than the typical dinner portion size. Remember to make healthy menu substitutions. It's good to ask if you can swap out one of the starchy sides for a side salad or fresh vegetable. Remember to omit or ask for all dressings and sauces on the side. Include vegetables in your order. Control your carbs and count them. Remember that everything you order should fit in your meal plan. And then leave off things like soda, juices, and the bread basket or chip basket to keep your carbohydrate levels in check. Let's talk a little bit about mental health. It's very important to control your stress levels when you have gestational diabetes. Stress, whether it is physical or emotional, always leads to increase in blood glucose. Stress is common during pregnancy. Any stress, whether it is physical or emotional, can cause elevated blood glucose levels. Unmanaged stress can lead to very high blood sugars. Coping skills are an important part of treating your gestational diabetes. There are lots of ways to relieve stress. Look at some of our examples here and see which one might be best for you. We recommend reading books or magazines, taking a walk or exercising, listening to your favorite music, meditating, getting a massage, taking a warm bath, going to a movie, doing a craft, talking with a friend, or taking a nap. Aside from normal stress associated with pregnancy, diabetes can put you at risk for postpartum depression. Postpartum depression is more severe than normal stress associated with pregnancy and can last a lot longer than your typical baby blues. If you have a history of depression or bipolar disorder prior to the pregnancy, you are also at an increased risk. Postpartum depression happens to 1 in every 9 new mothers. It's caused by the sudden hormonal changes that occur after delivery. It is a serious health condition, and it's important that you reach out to a friend, healthcare provider, physician, or family member if you are experiencing postpartum depression. Some of the symptoms of postpartum depression can leave you feeling emotionless or overly sad and can prevent you from bonding with your baby because you feel like you don't care or love for the baby. Again, it's important to tell someone if you're experiencing these symptoms. Loss of interest or pleasure in daily activities, change in your sleep patterns, change in appetite, feelings of worthlessness or guilty feelings, feeling irritable, trouble concentrating, loss of energy or fatigue, nervousness, weight changes, and most importantly, no interest in the baby or not feeling connected with your baby, or if you have suicidal thoughts. If you're experiencing one or more of these symptoms, it is time to get help. Please contact a healthcare provider, a trusted friend, or call the suicide prevention line for help. They're available 24/7. For our last session, we're going to be talking about the importance of follow-up care. Let's start with the immunizations. Hopefully, before you became pregnant, you were up to date with all your immunizations. During pregnancy, your doctor may recommend that you get an up-to-date flu shot or COVID shot, depending on the time of year. Make sure after delivery that you keep up with all your immunizations by regular visits to your doctor. One of the most important things that you can do after delivery is try and prevent type 2 diabetes, which we know is a risk factor for you having had gestational diabetes. For most women, after delivery, blood glucoses return to normal with less than 24 hours. However, it is important that you return to your doctor afterwards to be checked again. If the blood sugars do not return to normal after the delivery, we then change the diagnosis to type 2 diabetes. Half of all women that have gestational diabetes during pregnancy will go on to develop type 2 diabetes later in life. We want you to continue to monitor your blood sugar and blood pressure after delivery for approximately a few weeks. Follow up with your doctor 6 to 8 weeks after delivery so that they can do more formal exam and testing. If you've had gestational diabetes, you should get tested for diabetes at least every 3 years, and preferably every year. We know that preventing type 2 diabetes is possible. Let's talk a little bit about preventing type 2 diabetes. As you know, having gestational diabetes puts you at a higher risk for developing type 2 diabetes later in life. We also know that by continuing to be physically active, eating a healthy diet, and getting your weight back to normal, type 2 diabetes can be prevented and delayed. Breastfeeding helps get your weight back to normal because it involves burning a lot of excess calories. It also reduces your risk of breast and ovarian cancer later in life. At your delivery, you can ask for a lactation consultant to help you if you're having trouble with breastfeeding. Another benefit is it can save your family money. Thank you for joining us today for our educational session on gestational diabetes. It's important to us that you have a healthy and happy pregnancy and delivery. Please take a moment to contact our office. We can provide you with an individualized meal plan and more information about food. We have free diabetes testing supplies to provide, as well as additional resources. We look forward to hearing from you soon.